Good evening. Thanks for joining us tonight. Hundreds of Middle Tennessee families are worried because their small town hospitals closing. We got a lot of emails from you on this one. Several hospitals are closing because of rising health care costs. News 4's Edward Bird spoke with neighbors about the impact and what they're going to be forced to do next.
In just 4 weeks, people in and around Clay County won't be able to come to Cumberland River Hospital to get care. Instead, they're going to have to drive 30 to 40 minutes away to get to the next closest hospital. Folks I caught up with say that can be the difference between life and death.
And it is unconscionable. It is unmoral, unethical.
Steve Gardner moved to Clay County 5 years ago. A recent retiree, he wanted to settle in a rural community with a hospital nearby.
2 years ago, my wife had a collapsed lung. If I was unable to have brought her here, she probably wouldn't be alive today. That's a life.
We stand by this hospital. We support them 110%.
Natalie Boone serves as an EMT and ambulance driver. She says in 2018, nearly 600 patients were transported to Cumberland River Hospital. The majority are heart attack and stroke victims.
Those folks don't always have that extra 25 to 30 minutes to get to another facility to be stabilized. There's a lot of folks walking around in this county today because we were able to get those folks to this hospital to be stabilized before they could be transported on to another facility.
Carol Abney is a lifelong Clay County resident.
We've all used this hospital many times, but expanding Medicaid would help a ton.
Both the city and county mayors say they've been in constant contact with lawmakers at the State House and in D.C.
They've reassured us that this is going to be put on the front burner for them.
We're hoping that somebody may step in and try to buy it and keep it open.
The hospital is owned by Cookeville Regional Medical Center. Its CEO said in a statement that they are still looking for a potential buyer for this facility and that several entities have expressed interest. There are about 100 out of 146 employees that are full-time. Each of them here will get a severance. In Clay County, Edward Birch, News 4.
Now, State Representative John Mark Wendell represents neighboring Jackson County. He says Governor Bill Lee should sit down with President Donald Trump and Vice President Mike Pence to come up with a market-based approach to health care here in Tennessee. Wendell cites a bill that Pence crafted when he was governor of Indiana that provided care for 400,000 people.
It's a crisis, and I hope that we're going to take a sober look at it. I think that Tennesseans should be aware that if rural Tennessee is not healthy, both economically and physically, then there's a problem for all Tennesseans.
Wendell, a member of the House Finance, Ways and Means Committee, believes Medicaid expansion could help ease the burden that rural health care facilities are now facing. There's a lot of emotion in this story, and we got a response on these closures from Governor Bill Lee's office, saying Governor Lee is committed to making sure every Tennessean has access to affordable health care that they can afford, and he's working to address the root of the problem, which are skyrocketing costs in health care. One of his first initiatives, and in fact his first executive order, called on state departmental agencies to find ways to better serve our rural areas, including the delivery of health care services.